Hello, I'm Dr. Amador Flores. Today we're going to talk about diabetes, specifically diabetic eye disease. Diabetes is a condition that's usually broken down into two types, type 1, type 2. Type 1 is usually associated with juvenile diabetes, where these patients don't produce insulin, and so therefore they can't break down sugar into energy. And then the more common type, which is type 2, also known as insulin-resistant diabetes. And these are usually diabetics who the onset is usually later in life. As far as the eyes are concerned, diabetes can have very subtle effects and certainly more serious ones. Diabetes is one of the leading causes of blindness in the US, and it's also one of the leading causes of preventable blindness. Usually the biggest problem with diabetics is that they just don't get screened, either because they were never informed or because they just feel like if they see well, they don't have any problems, then everything must be okay as far as the eyes are concerned. But a lot of times these diabetics, when they go to their primary doctor and then the doctor doesn't emphasize them getting their eyes checked, can go undetected for many years. One of the things that we pride ourselves on is technology, and along those lines we have the OptoMap, and the OptoMap is really a fancy camera, for lack of a better term, that is able to map out the back part of the eye, and so it uses a low energy laser to scan the whole retina, and then just kind of spits out, if you will, the picture of what the back of the eye looks like. And by using the software that's integrated into the camera, we can look at the different layers of the retina and determine whether or not there's any problems in circulation. And again, because diabetes in the retina can cause blood vessels to leak or hemorrhage, they can also cause inflammation, and sometimes these subtle changes to the naked eye are difficult to pick up. And so that's where something like this, again, the OptoMap, comes in handy and allows us to study each of the different layers of the retina more closely to determine whether or not diabetes is a problem in these patients. We welcome, if you are diabetic or have a loved one who is diabetic, especially if they've never had their eyes checked or it's been a few years that they've had their eyes checked, it's important for them to come in, again, because diabetes is one of the leading causes of blindness in the US. It's important to get screened. So we welcome any appointments so that we can come in and have you checked.